Hi everyone, thank you for joining our health talk on COVID-19 vaccine. I'm Angel from Singapore Heart Foundation. Today, Prof. Tan Hui Chin, Chairman of Singapore Heart Foundation and Director of National University Heart Centre Singapore, will be sharing with us more on the COVID-19 vaccine. Before we begin, a reminder to those who are on Zoom to remain on mute when the speaker is speaking so that everyone can have a conducive learning environment. But you may unmute yourself if the speaker asks you to. Also, as we have many participants in this Zoom session, as well as those on YouTube, so please refrain from asking more than one question so that everyone can have their questions answered. For those of you who are on Zoom, please use the Zoom chat function to type your question. You can find the Zoom chat by clicking on more or the icon with the triple dots. So for viewers on YouTube, you may leave your questions in the comment box. Please note that you will need to sign into YouTube and have a channel in order to leave a comment. So without further ado, I'll hand the time over to Prof. Tan now. Prof. Tan, please.
Thank you very much, Angel, and I'd like to welcome everybody to this afternoon's webinar on COVID-19 vaccines. I feel that this is a particularly pertinent topic for members of the Singapore Heart Foundation as well as the public on whether heart patients should get vaccination. Now, let us just recall, because about this pandemic. This pandemic has been with us for more than a year already. Just remember, in 8th of December 2019, this was the time when the first cluster of pneumonia cases were observed in China. And then China informed WHO on the 31st of December 2019. And thereafter, in January, Thailand reported the first case, then followed by Vietnam, followed by Taiwan, Japan, and Germany. And look at Singapore. Singapore has its first imported case on the 23rd of January. And we have our first local transmission on the 4th of February. So that was the timeline of coronavirus in Singapore. So remember again, 29 January was our first case. Singapore elevates its alert level to a DORSCON orange on the 7th of February. And NUH, we are working and meet our first COVID-19 patients on the 11th of February. And the following month, exactly, WHO declares a COVID-19 to be a global pandemic. So, and 2 months after the first case of COVID diagnosed in Singapore, we have our first 2 COVID-19 deaths. And now, if you look as of 22nd of March 2021, looking at the whole world, 123 million have been infected with this virus. 2.7 million have died from this virus, and the highest reported case is in United States, as we all know. And right now in Singapore, we are pretty good at 60,000 not holding at this point in time. For those of us who have been tracking this pandemic, which I'm sure everybody is, there's actually two populations that are affected with coronavirus in our country. We have the community and we have, of course, the dormitory. As of March today, as I understand, our active cases are 137. And our mortality cases, fortunately, has remained 30. So if you look at Singapore's mortality cases, we are obviously much lower than the world. For example, if you look at America, the mortality cases is 1.8% for their patients. In Germany, which is a very advanced European country, the mortality is 2.8%. Mexico has got the highest mortality in the world at 9%. And Singapore has a mortality of 0.05%. So we have really shown ourselves to be very, very good in terms of combating this particular pandemic. And there are, of course, very heart-warming stories, particularly in NUH, where we save 2 lives using our specialized life support machine called the ECMO machine. Mr. To is a 54-year-old gentleman with high cholesterol. He had a heart that stopped for 16 minutes, but he survived the whole thing and stayed in the hospital for 42 days. Then we also have Madam Choi, 58-year-old, came back from UK, contracted the virus, was hospitalized in hospital NUH for 4 months, and she was on life support machine for 1 month, and she miraculously actually survived. Then this gentleman captures the entire Singaporean attention. This is Mr. Raju Saka. As we know, his case number 42, as we call him, stayed in hospital for 5 months, 2 months of which in ICU, and had a baby born while he was in ICU, and he incredibly survived. So these are very, very heart touching stories that we all like to celebrate. In this afternoon, I want to focus on 3 areas. One is COVID and heart disease. How does it affect heart patients? Number 2, I'm going to talk about the types and the efficacy of vaccine. What do we understand by the different types, and what do we understand by efficacy and effectiveness? Number 3, I'm going to talk about safety of vaccine. Now let's talk about COVID and heart disease. When we look at the initial publications on the patients with COVID infections, we actually discover that many of them have underlying chronic medical conditions. And this includes hypertension in this American series of 56.5%, obesity 41%, diabetes was present in 33% of patients. When you look at the Chinese populations from Lanzhou and so far, 1,500 patients, hypertension 21%, diabetes 9.7%. So all these chronic risk factors for heart disease were very prominent in the patients who have COVID infection. When we look at our first 100 COVID patients in Singapore, hypertension among them was 20%, diabetes was 10%, so very high prevalence here. Now, we also know that when you have a heart disease or when you have diabetes, your mortality risk from COVID-19 infection is very high. It's almost like 11 times compared to people with nothing at all. So 10.5% of death in people with heart disease compared to 0.9 in people without a heart disease condition. And what is also interesting is that when you have COVID-19 infection, it is not a illness that just affects the lungs. In fact, it actually affects the entire systemic organs, of which heart is one of them. And when we take the blood of patients with COVID-19 infection and we measure them for this particular biomarkers called troponin, which is an indicator of injury to the heart muscle, 1/3 of hospitalized COVID-19 patients actually have muscle injury to the heart, as evidenced by an increase in the level of troponin. When you have a high troponin level, it translates into higher chance of dying, higher rate of abnormal heart rhythm, and higher rate of heart failure. So involvement of the heart becomes a very important prognostic factor for a patient with COVID-19 infection. What is also more alarming is that if you have underlying heart disease and you now have a heart muscle injury as evidenced by elevated troponin, and you have COVID-19 infection, your chance of dying is 70%. So in this particular series. So this is not a good situation for heart disease patient. And we know the mechanism of it. This virus can attack the heart muscles directly, like all flu virus or any other virus, causing what we call a myocarditis. This virus can also promote blood clot formations in the heart artery and causing heart attack in a person. And we also know that this virus can sometimes cause a direct weakening of the heart muscle. It's what we call a stress cardiomyopathy. And it can actually incite a systemic inflammatory response, causing all kinds of multi-organ failure in our patients with heart disease. So heart disease patients now is a recognized high-risk population in patients with COVID-19 infection. In fact, every risk factors of hypertension, diabetes, cholesterol, every heart conditions like heart attack, previous heart attack, heart failure, abnormal heart rhythms were a additional prognostic factor as far as survival from COVID-19 infection is concerned. So we know that this virus, when it affects a person in the first 1 week or so, you pretty much have very mild symptoms or no symptoms. After 1 week, those who are destined to recover will recover after 1 week. But those patients who turn bad and becomes worse in terms of their need for oxygen therapy, in terms of their need for supportive treatment and so forth, actually starts after the first 1 week. So second week to the third week is actually a very critical period as far as the COVID-19 patient is concerned. This is where all the complications, including blood clot formation, including the risk of heart failure, comes on, and which is between second and the third week. And this is because of a sort of a very hyper exaggerated immune response mounted by an individual when they are exposed to this virus. And this immune response is a totally dysregulated, totally inappropriate hyper response that ultimately hurts the patients in the process. Now, one thing that we observed during this whole last year, as particularly in the Western country, is that the number of people admitted to hospital during the COVID pandemic period with heart attack number actually dropped. But although there was a reduced number of patients going to the hospital with heart attack, but the people that go into the hospital with heart attack, the death rate of them surviving becomes higher. So the chances of survival for a heart attack actually becomes lower in those who were admitted to the hospital. What is also interesting is that when you have heart attack and you are positive for COVID-19 infection, your chance of dying is nearly 1 in 3. So it's about 30%. This is in contrast to most times where if you have a heart attack, your chance of dying is actually single digit, less than 10%, so with modern care and so forth. Another interesting phenomena that we observe is that fewer people are coming to the hospital with heart attack, but more people are actually having cardiac arrest outside hospital. And the chance of resuscitating them and keeping them alive when they have an out of hospital cardiac arrest actually dropped. So fatality rate was more than 90% in particular New York City. So it tells us that people were actually going to a hospital. First of all, people were reluctant to go to hospital when they have a heart attack. And even if they go to hospital, they go in very late, and that results in a cardiac arrest at home or resulting in complications that come on in that make it very difficult to salvage them when they are admitted to the hospital. So heart disease and COVID is not a very good combination here. And so then we're going to talk about type and the efficacy of vaccine. So you can ask, what is vaccination? Well, vaccination is a very simple, safe, and effective way of protecting people against a harmful disease. It actually uses your own body's natural defenses to build resistance to specific infections when you are exposed to it, and makes your immune system stronger. So your vaccines actually train your immune system to create antibody so that it can fight whatever virus that you are exposed to. And we all know from the history of mankind that vaccination works against pandemics, work against viral pandemic. We have a past history to success story to tell us. The story of poliomyelitis, the story of smallpox, story of yellow fever. All these were wiped out because we developed vaccine. So there's no reason to believe that this coronavirus cannot be wiped out if we have an effective vaccine as well as a vaccination program. Now, why is vaccination important? So you will ask, and many people are going to ask me. So when you get vaccinated, you protect yourselves. Not only do you protect yourself, especially if you're a heart disease patient, but you actually also protect everybody around you. That is unlikely that you may have a lesser chance of spreading the virus around your families, your loved ones, and your friends. And for those people who are unable to take vaccine because of some medical reasons, and if many of us, majority of us are vaccinated, then you can help to reduce the spread of the disease to this individual as well. So it's almost, to me, like a societal responsibility to get yourself vaccinated for yourself, for your family, and for your society. And so we all know that Singapore got this vaccine way back on the 22nd of December 2020. And then in the same month, we have our first vaccine recipient. And this was first done on the 30th of December, as you all may remember. It was carried out at the NCID, where the staff, first 40 staff, received the first Pfizer-BioNTech vaccine. And PM Lee at that time was quoted as saying, vaccine is the key to living in a COVID-19 world. I would say it's the key to surviving in a COVID-19 world. Now, there are basically three main approaches to making vaccine. One is taking the whole of the virus as a study sample. The other one is to take some components, some parts of the virus to use to make vaccine. And the third part is actually to use the genetic material that we know of the virus to make the vaccine. So what is a whole virus? What is a part virus, and what is a genetic nucleic acid virus vaccine? So let's look at this whole virus concept here. So what we can do is that we can take this whole virus and we sort of kill it and inactivate it and becomes a vaccine. So while it can provoke an immune response, it can't hurt the patient. Or we can make the virus more harmless. So we can take away the dangerous part of it and continue to give it as a form of a live virus, but it is attenuated, as we call it. Or we can take the virus material and put it inside another virus, which is less harmful or known to be safe to human being, and then carry this genetic material of this harmful virus that we want to vaccinate against and inject into the patient. So inactivated vaccine has been used in many vaccines before. The flu vaccine, the polio vaccines are all inactivated vaccines. Basically, you kill the virus using chemical, heat, or radiation. But it requires special laboratory facility to grow the virus safely, obviously. And of course, it takes time to develop this vaccine because you need to grow the virus and inactivate it. And similarly, for live attenuated virus, it is living but weakened virus. So it's not so suitable for people with compromised immune system because it's a living virus. And examples of these vaccines will be the measles, mumps, and rubella vaccines, MMR, chickenpox, and your shingles vaccine. Then we have a viral vector vaccine where you use a safe virus to deliver a specific subpart of this harmful virus that you want to protect against, and then inject it into a patient. So once you inject into patients, the particle will then promote a formation of a specific protein that you want the body to identify, and then trigger the immune response. Example of a viral vector vaccine will be the Ebola vaccine. The second way where you develop a vaccine is to take a part of the vaccine and then you deliver it to the patient. And so this part can be either a protein on the surface of the virus, or it could be also a sugar component, for example. And using specific part of a virus for vaccine is been used in whooping cough vaccine, tetanus vaccine, diphtheria, and meningococcal virus vaccine. The third part is the most exciting one, which is the one of current interest, is the nucleic acid vaccine. This is using a specific portion of the virus genetic material, which codes for a specific protein, and then introduce it into a patient so that the proteins will be produced and that the body will be able to trigger an immune response against it. So we can actually take the viral genetic material, the wholesome, the original, which is the DNA, or we can use an RNA, which is oftentimes a sort of a replica of a DNA, where DNA will have to convert to an mRNA before it can start producing protein in order to replicate the virus. So nucleic acid vaccine can be both a DNA or could be a messenger RNA. So this genetic material delivers a specific set of instructions to the cells when you inject into it, and you make them produce a specific protein that you want your immune system to recognize and respond to. In the coronavirus, the protein that we ask this vaccine to produce is the spike protein on the surface of the virus, which attach the virus onto the surface of the lung tissue and so forth. So this is a very new way of developing vaccine. But actually, before the COVID-19 pandemic, none of this nucleic acid vaccine has been approved in a very formal processes. Although many of these vaccines were actually being used, this technology was being used to treat patients with certain types of cancer. Now, because of this COVID-19 pandemic, the research in the nucleic acid vaccine has progressed very fast. In fact, it's totally accelerated, such that now there are a couple of mRNA vaccines that have been approved for emergency use authorizations against COVID-19. So we are now able to give the vaccine to people beyond just using them in the clinical trials in a very fast fashion. So this is how the mRNA vaccine works, which is what the vaccines that Singaporeans are now receiving. So when you have a mRNA vaccine, basically we take the genetic material of the virus that codes the specific surface protein. And then we sort of encapsulated it. We sort of put it inside a lipid, a fatty capsule surface. So when you have a fat covering and you have your DNA mRNA material, which you then inject into the patient, the mRNA then activate the cell of the host, take over the machinery of the cells to produce the protein that resembles that of the spike protein on the surface of the virus. And when this protein is released into the bloodstream, the body now recognizes this as foreign and starts to produce antibody against it. And so this is the mechanism of an mRNA vaccine. Now, people are terribly worried because they think that, well, this vaccine comes in such a short period of time. Is it safe? Is it not safe? And so forth. Well, should I be taking it? Actually, mRNA vaccine has been used in humans for HIV, for rabies, and influenza with great tolerability. Now, this mRNA vaccine will not alter your human chromosome. It will not change your gene inside your cell. So you don't have to worry about some genetic changes in your own body, because this mRNA vaccine is actually very short-lived. It will be degraded within 48 hours, and it cannot be so it's taken up by the cells. It is inside the so-called cytoplasm of the cell, which is the main body of the cell. It doesn't go into the nucleus where the DNA is located. So if you understand the science of it, this mRNA can never change the genetic structure of a patient. Then you can ask, but it's developed in such a quick fashion. Is it safe? Well, the mRNA vaccine is developed in such a quick manner is because this technology does not require you to grow the virus. So you only need to develop the sequence to that protein, which can be produced very quickly. And secondly, you will realize that this vaccines has been rolled out in many countries, supported by various governments with huge amount of resources put in. So the companies can just devote their entire energy and resource to producing this virus. And normally when you develop a vaccine, you go through different stages, stage 1, stage 2, stage 3, and you wait for the results of stage 1 before you go on to the next stage. But here we have no time. So we basically start off all the stages pretty much at the same time, so that if we get a positive result in stage 1, we just also probably will get a positive result in stage 3. Plus, we have a pandemic. We have so many patients with COVID-19 in the world. We can run the trials very quickly in the shortest possible time. In the past, if you want to develop a vaccine against malaria, for example, you have to wait for a number of malaria cases before you compare those with without the vaccine. But now everybody seems to have COVID-19, particularly in a high prevalence country. You can run the trial very quickly. And that's why the mRNA vaccines have been able to come on quickly onto the market and be rolled out for clinical use. Now, I want to talk about the types of mRNA vaccine. But before we go into an mRNA vaccine, we really have to thank this lady, Professor Kathleen Carico. This is a lady that really is the pioneer of the mRNA technology. When she came up with this mRNA technology, nobody believed her, actually. She nearly lost a professorship in the University of Pennsylvania just because she was so focused on working on this mRNA technology. Later on, she actually joined up and sold her technology to BioNTech, which is then bought a partner with Pfizer to produce the vaccine that we all know of today. So she's really the pioneer. But as we also know, she sold the technology to BioNTech, which is founded by this couple, this German couple of basically of Turkish descent, and that they took up this challenge of making mRNA vaccine, and now they are actually a billionaire. But I was told that they still go to work in a bicycle and living in a very modest accommodation despite their wealth. And then we have Mr. Bansal, who is the Moderna CEO. This company has been working on mRNA technology for a while, and she realized that this is it. So he actually called his team. Within 2 days, they actually created the RNA sequences that would produce the spike protein. And 41 later, she shipped the first box to the USA National Institute of Health and begin the early trial. So these mRNA companies were very quick in terms of their development of this vaccine against coronavirus. Now let's talk about Pfizer BioNTech. This vaccine is a bit of a challenge in terms of its distribution, because we all must have heard now that it needs to be stored in a minus 70 degrees during transportation. Not every airline is capable of doing that. At minus 20 degrees, this vaccine is only stable for 2 weeks. Once you take it out and put it in your normal fridge, it can only last for about 5 days, so you have to use it up very quickly. Now, this vaccine has to be reconstituted. It contains enough of doses where after you dilute it with some normal saline, you inject about 0.3 cc into each and every of the recipient. But sometimes the vaccine comes in slightly more doses, so you possibly can inject it into even the 6 or 7 recipients, although most of the time it can only be given to 5 people. But once you open up the vaccine, the doses will have to be administered quickly within 6 hours. And that's why in Singapore, we are very careful with its use. We try to make sure that everybody comes on time and don't waste the vaccine. So there are now 2 vaccines available in Singapore, and it's been approved. One, as we know, is the Pfizer BioNTech, and one is the Moderna vaccine. In terms of efficacy, Moderna is 94%, Pfizer is 95%. This so far the highest in the market, and probably will now serve as the gold standard reference by which all vaccines will be measured against. The doses, both of them requires 2 doses of an injection, 28 days apart for Moderna and 21 days for Pfizer. The minimum age of use is 18 for Moderna and 16 for Pfizer. This Moderna can be stored in minus 20 degree, but Pfizer will have to be stored in minus 70. So Pfizer, as we all know, is approved by Singapore in December 2020. Moderna approved in February 2021. Now, when we talk about effectiveness, what do we mean? When we talk about the effectiveness, we are talking about how well this vaccine protects somebody against developing symptoms of COVID-19. It doesn't mean that you will not catch the infection, but the chance of you developing a symptom as a result of catching this infection is significantly lower if you are vaccinated, which means to say that you are 95% less likely to develop symptoms when you are vaccinated and exposed to the COVID-19 infection. So Moderna, on the other hand, is 94% efficacious. So in FDA standard, any vaccine that is at least 50% efficacious is considered good enough in terms of protecting a person, people from the disease. So you don't have to worry whether it's 79 or 80 or 95 and so forth. Essentially, if it's more than 50%, this is a vaccine that will be used for practice. So let's compare again the Pfizer vaccine versus Moderna vaccine again. I said before, the efficacy is 95 versus 94, which is very close. Now, this is the prevention of any sort of symptom. But more importantly, when you look at it, it also is highly effective in preventing severe disease and 100% effective in preventing death, or 90% in reducing the need for hospitalization. So you have a vaccine now. When you get vaccinated, you are unlikely to die from when you catch the COVID-19 infection. 95% of the time, you're going to be well with no symptoms when you get vaccinated. Okay, it doesn't mean that you will not have the infections coming into you, but it's unlikely that you will require hospitalization. It is unlikely that you develop severe form of COVID-19 pneumonia and require ventilation, and you are unlikely to die from COVID-19 infection. So when we have a vaccines available, we need to talk about the national deployment and vaccination plan and how to roll it out to the whole whole world and to every single person in the country is a big logistical exercise. But what we do know is that Israel probably is the first country to roll out in a massive scale. And actually, the world has now a lot to learn from Israel, because we now know that for people in Israel who gets the Pfizer vaccine, it is 94% effective. So it's consistent with the trial finding, but this is a real world population, that the chance of them developing symptoms is very low, so less than 6%. So 94% to prevent against the development of symptoms from a COVID-19 infection. So then you say, oh, what's the big deal? So I just don't get symptoms, but I still can catch the virus. I potentially could still spread to somebody who is not vaccinated. That may be correct. We just don't have enough information, but I can tell you that the early evidence coming out from the research, as we know in Israel, again, for those who receive a vaccine, very few people actually catch the infection. So this is real world data. But more importantly, if you see Israel, the death rate for people with COVID-19 infection has dropped significantly after they have rolled out the vaccine program. In fact, the whole world, those who are giving the vaccine are seeing a reduction in terms of mortality. Even USA, which has got the highest incidence, is seeing a gradual reduction in the number of people who are hospitalized for COVID-19 infection, suggesting to us perhaps it is protecting against a transmission as well. Now, we also know from a local study that when we give a vaccine, it is possible that one can develop antibody very soon. So 12 days after one dose, at least in this particular study, suggests that one may develop some form of immunity. But we will always say that after first dose, you get about 50% of immunity. After your second dose, 2 weeks after, you probably get a full 95% immunity against COVID-19 infection. So it takes a while. It takes about five weeks at least for the 2 doses of vaccine to work. So it doesn't mean that if you want to travel tomorrow, today, you go for vaccination, you'll be protected. It doesn't work that way. So let's talk about the safety of vaccine as the last aspect of it. And so I covered people concerned about too fast a vaccine development. I already explained to you that it is because of this new technology, and it's because the way the clinical trials are being rolled out, and because we are operating in a pandemic environment, that we are able to do this vaccine rollout quickly. And of course, we will always hear about people getting bad outcomes after COVID-19 vaccination. So in Singapore, we have a gentleman that died the same day after receiving vaccination, but this has been certified to be unrelated to the vaccine. Remember, in elderly patients, you get heart attack commonly. So when you have 2 common events happening at the same time, they may not be associated, as we would say. So the cost-effective causal relationship may not be there here. So what are the common side effects that we know from this COVID-19 vaccinations? Both the Pfizer and the Moderna share many common side effects, including swelling, redness at the injection site, fatigue, headache, muscle pain, and so forth. Some may not experience any symptoms at all, nothing more than just a sore arm. Most of the side effects, I would say, is fairly mild. Some people may report just feeling pretty lousy and so forth. But it is true that the side effects tend to be worse after the second dose of the vaccine. 75% of people will experience some kind of pain at the injection site. Others may experience some kind of chills and fever and so forth. So let me just say that actually side effects are also a sign that your immune system is responding to the vaccine, particularly after the second dose. But don't be worried if you don't get a side effect after the second vaccine. It doesn't mean that you're not having an immune response. It means that you're just blessed without any side effect. So if you look at the Pfizer vaccine and the Moderna vaccine and compare with the usual other vaccine, actually the side effect with the first dose is pretty much the same as the usual vaccine that we go for, like a flu vaccine and so forth. But it is the second dose of vaccine that causes more side effects in terms of pain and fatigue and headache and myalgia, muscle aches and so forth. But like I say, all these side effects are typically very mild. The only thing that we are really worried about after a vaccine is what we call a severe allergic reaction called anaphylaxis. So anaphylaxis is somebody who developed a rash and lip and eye swelling alongside with a respiratory distress. They can't breathe and their blood pressure fall and they go into shock state. So that's anaphylaxis. Anaphylaxis occurs in 5 per million of Pfizer BioNTech, at least in the early experience, and occurs in 2.8 per million in the Moderna. So Moderna has a slightly lower rate of anaphylaxis compared to COVID Pfizer and BioNTech. So I got mine. So if I have mine and I'm well, so there's no reason why you can't take your vaccine as well. But there are certain group of patients that we still advise against taking the vaccine. People who has got anaphylaxis, so severe swelling of your eyes or legs or lips, alongside with bronchospasm, with spasm of your airway. People who develop severe drug reactions before in the form of Stevens-Johnson syndrome, that means you shed your skin and so forth, or people who have known allergic reaction to the first dose of the vaccine, whichever that they have chosen, pregnant women, severely immunocompromised patient, and children under the age of 16. At this point in time, we don't have enough data to support their use. So this is the latest MOH guidelines on patients with allergy. In fact, now we say that not every patient with any form of allergy cannot receive the vaccination. Only, so those who have a history of allergic reaction to any drugs, food, not amounting to anaphylaxis can be vaccinated. So you just get a little bit of rash, a little bit of eye swelling and so forth, that's okay. People who have a history of multiple allergy not amounting to anaphylaxis can be vaccinated. People with atopy, those with skin eczema, those who have allergic rhinitis, keep having running nose, previous asthma can be vaccinated. If your family member has got a history of anaphylaxis, but you don't have, you are eligible for vaccination. So the whole threshold for vaccination actually has been lowered as we become more and more familiar with this vaccine. So a certain group of patients, perhaps we should still not give vaccination. So those with a history of allergy to other vaccines, maybe we don't give. People with definite anaphylaxis, better we don't give. And people who have anaphylaxis that require an EpiPen for injection to recover, we should not give at this point in time. So my take here is that talk to your doctors who's looking after you, your GP, your specialist, and so forth. Find out if they think that you are suitable for vaccinations. But I can tell you that majority of you will be safe for vaccination. And this is the sort of message that we want to send out to all our patients, particularly in heart center, in NUH as well, where we keep educating our patients. In fact, there is no heart conditions that you cannot go for a vaccination. Every heart patient can go for heart vaccination. In fact, I would tell you that the decisions to vaccinate or not is really a personal one. It's up to you to decide. Right now in Singapore, it is still a very voluntary base. Nobody is forcing you, but we just tell you what are the good things and the potential side effects, and you have to make your own personal decision. But there are already pushback, and some colleagues were saying that perhaps those who refuse vaccine and want to endanger themselves, possibly endangering others, should suffer as a result. So this is getting quite controversial, but I can tell you that CDC now says that for people who have been vaccinated, you are free to visit other vaccinated people in the private sector. You can even enjoy a meal with people who are vaccinated. You can visit unvaccinated people as long as they are at low risk. You don't need to be quarantined or get tested after exposure to a COVID-19 infection. So as long as you don't show symptoms. So the bar now for vaccinated people has been lowered. So people are going to be allowed to travel or do more activities once they are vaccinated. In fact, certain airlines are now saying that you have to be vaccinated to fly in their airlines. Qantas is one of them. In Singapore, if you're going for one, as we open up and go for some of this larger crowd gathering, if you have been vaccinated, you don't have to do all this rapid antigen tests PCR before attending all those big crowd event. And I know that in Israel, they will allow people to go and watch soccer in the stadium if they are vaccinated. And one of the concerns that the whole world is facing is, of course, the supply of the vaccine. So while we don't have a problem in Singapore right now, you can never tell whether, because the whole issue is now so politicized that sometimes the vaccine supply may be a problem, and you really don't want to be caught out with no vaccine to take, should you require one or desire to have one. So this is a statement from all the cardiologists in this country, and we want to tell all our patients, particularly those with heart disease, that all patients with pre-existing cardiovascular disease carry a higher risk of severe complications from COVID-19 infection. This I already informed you. And all the approved COVID-19 vaccinations are safe and efficacious in the vast majority of patients with cardiovascular disease, including those with prior heart attack, those on blood thinners for heart condition, heart rhythm problems, heart failure, and prior heart surgery or procedure. There's no need for you to stop any of your blood thinning medicine, your aspirin, your clopidogrel, or any of the anticoagulant for the vaccination. Though for those who are on anticoagulant strong blood thinning medicine, you could just press on the injection site for a longer period of time, like 5 minutes, and that should be okay. There's no need to stop the medicine or alter the regimen of your medicine going for this vaccination. Just go as per usual in your daily routine. So I'm proud to say that, in fact, all my staff in NUH will carry this badge as we complete our vaccination program, and our chief executive will thank us for making the difference and keeping all of us safe. Let us continue our vigilance and resilience in the battle against COVID-19 pandemic. And finally, I'd just want to thank all my colleagues here from the National University Heart Center who have gone beyond their call of duty to volunteer at the dormitory, at the community care facilities, and continue to manage COVID-19 patients when they are admitted to the hospital. Let not all their work go into vain, as we have won this battle, but not the war. And so do our part in getting yourself vaccinated. Thank you very much for your attention.
Yeah, Prof. Tan, on hand we have some questions. So the first question is, assuming that I need to be vaccinated, would you agree that a vaccine made by conventional means, such as Sinovac, would be a safer choice than the mRNA type?
There's no evidence to suggest that one vaccine is superior to another at this point in time. I would say that you should go with the approved vaccines by Singapore Health Science Authority and not wait for the other vaccines to come along. So the other vaccines are still being evaluated. We are still not totally sure about their safety and efficacy. My take here is that why wait? You already have a safe and efficacious vaccine around, and take it while you still are able to get it. So no point in waiting any longer.
Okay. The other question we received from two participants, like those heart failure patient with low heart rate, less than 50, or low ejection fraction less than 35. Is it okay to get vaccinated?
Yeah. So like I say, all heart conditioned patients are eligible and safe to receive vaccination. All the more because you are a high-risk group of patients. And like I say, anybody with heart failure or heart attack before catching a COVID-19 infection put you at tremendous risk compared to people with no background heart disease. So you should go for it for your own safety and protection, sir.
The next question, there is this participant who is on a few medicines such as peridoflualbumine, Concor bisoprolol, fumarate, cardiopyrin, aspirin, and atorvastatin. Can this person take the vaccine?
Yes, like I say, aspirin is not a contraindication. The medicines mentioned are very common medicines prescribed for patients with heart disease, particularly those with hypertension and blocked artery problem and so forth. So these are not contraindications to vaccination. In fact, like I say, there are very few cardiac contraindications, in fact, hardly at all, which says that you cannot go for vaccinations. So no heart condition, no specific drugs that says that you cannot go for vaccination unless you're allergic to it.
Okay, next question. Hold on. What happens when allergy occurs immediately after the first dose? Is second dose really necessary?
I think if you develop allergic reactions, particularly in a very severe form, then automatically you're disqualified from a second dose vaccination. But if this is just side effect, then it's not a problem. Okay, so has to be a allergic reactions where the doctor will be there to assess. In fact, if you have gone for your vaccination, you realize that you have to be kept for half an hour for observation. And this is because most of the severe allergic reaction occurs within the first 15 minutes. So we're even more careful. We extend it to half an hour to keep everybody under observation. And if you don't develop any reaction at a point in time after half an hour, it's unlikely that you will develop any more. So then you're safe.
Okay. The next question, I have IgA. Is it suitable to take the vaccine or any of the type of vaccine to avoid?
IgA refers to a specific type of antibody that you, what is IgA here?
Mr. Desmond, this question is from Mr. Desmond. Could you elaborate? Perhaps you can unmute yourself.
Is it a kidney problem?
Can you hear me?
Yes, we can.
Okay, I have immunoglobulin nephritis, probable, and the immunity is attacking my own organs, and I'm taking anti-suppression drug such as candesartan and bosporol to slow down my heart rate. I developed high blood pressure because of this, and the medication is to actually slow down my heart rate and also to dilute my palate. I'm taking bosporol and also candesartan.
On this,
and another pill.
Yeah, so candesartan, bisoprolol, all these are heart medicine that will not impact your ability to receive vaccine. But as far as the immunosuppressant is concerned, I would suggest you talk to your nephrologist and see whether he thinks that you are fit for this. Certainly, we don't want patients with any form of immunosuppressions to go for this vaccine for now.
Is this considered in this kind of a medication considered a immunotherapy?
No. So yours is not
Okay.
immunotherapy. Yeah.
So most probably I have to take the vaccine actually.
If you can take the vaccine, it's good for you. But
Okay,
I would
thank you
suggest
so
you
much.
discuss with your doctor.
Right, no problem. Thank you so much.
Thank you. Okay, the next question, if side effect is swelling of lymph node at neck area, what does it say about the patient body reaction to the vaccine?
There is, so this is a reactogenic vaccine, as we call it. It does provoke a reaction. And so your body is mounting an immune response to it. So you are responding to what the vaccine is supposed to do. So this is just part of this whole vaccination process. It doesn't mean that you caught the infection. And to treat the symptoms, if you have severe symptoms, headache, pain, and so forth, you can take some painkiller. But otherwise, these are very mild and it will resolve by itself over a day or two.
Okay. The next question, any difference between first and second dose, and why is there a higher reaction after the second dose?
Because the first dose has primed your body to this protein that is being released. So your body now has got some kind of antibody that has been produced. So the second dose is meant to be a booster dose to remind the body that, hey, there's this antibody that we need to, this protein that we need to protect against. So it's a second stimulation to mount an even greater response. So, and that's why some people developed more reactions because of the prior exposure. And so in some way, I would think that the reaction is a affirmation of that the body is now recognizing this vaccine, this foreign protein that you want to be protected against.
When we develop the symptom like fever, rash, etc., should you go see your doctor or take paracetamol?
You can take a paracetamol because the fever usually is quite mild and muscle aches is also quite mild. You can take your self-medicate with very simple medicine. If you don't get better after a day, then perhaps you can consult your family physicians. But I would say that most of the time people will recover.
Okay. Can a person with asthma take the vaccination?
Yes, yes.
Okay. Next is, can patient with pacemaker get vaccinated?
Absolutely. Yeah.
Okay. For a patient who had tetanus during young age and also allergy to stomatial, also with cardiomyositis before, do you advise to go ahead with the vaccine?
So you have some kind of drug reactions before, like in this case, stem material. And like I say, if the reaction is not severe as to cause you to have respiratory difficulty, breathing difficulty, or go into collapse, dizzy, faint, and so forth, then you're still fit because there's not anaphylaxis. Just mild drug reaction can still qualify you for vaccination.
Next question. I'm on cardiac medication, hypertension medication, and have asthmatic condition. Can I take the vaccine?
Yes, none of this preclude vaccination.
Okay. What kind of allergy after the first dosage must we look out for to decide whether to take the second dosage?
Anaphylaxis, and that will occur immediately within the first 15 minutes after vaccination. So we will be watching out for that for you.
Okay. Are thyroid patient able to take the vaccine?
Yes.
Okay. Is it safe for bypass patient who have recovered to take the vaccination?
Absolutely.
Okay. If I'm allergic to aspirin, can I take the vaccination? The allergy causes the whole face to be swollen.
Yes. So now we feel that allergy to aspirin is a different sort of allergic response from the usual sort of allergic reaction to vaccine that we're worried about. So for this particular class of drug allergic reaction, we say that you're fit to go for vaccination.
Okay. Hold on a second. Yeah. Another question was those with frequent irregular heart rates, can they get vaccinated?
Yes.
Hold on, let me check if there's more questions from the YouTube. How about those with aortic dissection, A repair and B medically managed?
Yes. No contraindications to vaccination for this condition.
For person with anxiety and depression, can they take the vaccination?
Yeah, no reason why you can't.
Okay. I think so far that's all for the questions over at the YouTube and over at the Zoom chat. There's one more. Okay, there's this question. My parents in their 90s have been advised that they do not need to take the jab since they are not going out by the healthcare workers. Is this right?
I actually don't think so, because I think if you are very elderly, you are the high-risk populations that we want to protect you against COVID-19. This virus is a little bit cruel. It affects the older people more than the young ones. And while you may say that you don't want to go out, but your family members whom you are in contact with could very well carry this virus, or your friends or visit you and so forth. So you never can be sure. And not only if you catch the virus, you put yourself in great danger, but if you catch the virus, you also make everybody around you been exposed to it as well. And so even if you don't die from it, the social cost, the economic cost of having to be quarantined for 2 weeks and so forth for everybody around you is tremendous as well, I feel. So So it doesn't mean you hide yourself, or unless you're real hermit here, you cut yourself from the rest of the world. But we humans are not like that. We are still social creatures in many ways. So I would say that given the risk versus the benefit here, the risk of getting vaccine is so low that the vaccine it justify the use of the vaccine in your case, even if you are 90 years old, particularly if you are still well and good. But let me say, if you are completely bedridden, on ventilator and so forth, perhaps there's no point. But if you are well and fit, please go for your vaccination.
The next question, how about patient with cancer history? Is there anything to take note of?
No, I think if it's a remote history or cancer in remission, you are also fit for vaccinations. I think the ministry have pretty clear guidelines, which you can check with your oncologist. But certainly, if you are not someone who is currently on chemotherapy or immunotherapy and so forth, you are fit for vaccinations.
Okay. Can fibromyalgia patient with allergy to steroid and superrazine take the vaccination?
No reason again why you can't take vaccine.
Okay. If this person has an immune system disorder, can they take the vaccination?
So I would like to know what sort of immune system disorder. This is a real time where you need to have the conversations with your immunologists and your doctors to discuss.
Yeah. So far, that is all for the question. Over at the Zoom chat, is there any more questions? If there is, you may type over at the Zoom chat box.
Excuse me, I cannot find the chat box.
Oh, sorry, who is this? Yeah, sure,
I'm
go
Audrey
ahead.
here.
Yeah, please go
Prof,
ahead.
Prof Tan, I'm Audrey Lee here.
Hi.
In 2016, I went for chemo and I had a reaction due to one of the chemo drug. Two of the chemo drug, it was very bad that my oxygen level fell to 40. And after that, I stopped my chemo at the 17. I supposed to complete at 20 because of my heart failure. So now my heart has progressed to 51% after the echo scan. Do I still qualify? I feel I want to go, but when I went to log in, I was rejected.
So I think the heart conditions is not an issue here. But the reactions, I need to have more information with regard to the type of reaction that you have for your chemo. And again, I would say that you should have that conversation with your oncologist who administered the chemotherapy to you. And that if he or she thinks that it's okay, then she can give you a letter and to say that you're fit for vaccination, and you carry it with you to the vaccination center.
And regarding my heart, mine is only functioning at 51%, and I get breathless quite easily. Do you think it's advisable? I really want to go for the jab.
So the heart condition is not an issue here. Yeah.
Okay, thank you, Prof. Tan.
Thank you. The next, I'm on insulin and aspirin. Am I eligible to take the vaccine?
Yes, diabetic patients are high risk, so you should go.
Amyloidosis skin problem, can they take the vaccine?
Yes.
So
So if you look at the list of contraindications under MOH guidelines, there are very few actually.
Another question is, can valve replacement patient take the vaccine?
Absolutely, you're a heart patient.
If a person for a minor procedure requiring GA, how long a gap before going for this vaccination?
Requiring, sorry, I didn't get.
GA.
Regarding GA, no issue here. So if you are sufficiently recovered from your operations, you can go for it.
Okay. How about people suffering from pemphigus foliaceus?
I don't see any issue again. This is a skin reaction problem.
Okay. What activities besides strenuous exercise to avoid after the vaccination?
No specific activity. So listen to your body. If you feel well and so forth, I felt well, so I went for my exercise the following day. But if you don't feel well, you feel a little bit under the weather, so just listen to the body and take a couple of days off from work or and rest at home. So.
Okay. Any risk for those with penicillin allergy?
Okay, so I need to know the extent of your allergic reaction again. Does it amount to an anaphylaxis?
That one we are not too sure because it's asked from the YouTube.
Yeah. So if it's not anaphylaxis, you could perhaps go for the vaccination.
Okay. There was a repeated question. People with irregular heartbeats, can they take the vaccine? I have a nephrotic syndrome history, asthma, high blood pressure. In 2019, I have a cardiac arrest and was told I have irregular heartbeat. Can I take the vaccine?
Yes. With so many concurrent comorbidity, so many medical problems, you are safer with the vaccines.
Can HB carrier go for the vaccine?
Yes.
Next is, can hypertrophic cardiomyopathy patient taking beta blocker and going for glaucoma tube implant soon take the vaccine?
Yes.
Yeah.
So notice that there's actually no pre-existing heart disease or cardiac conditions that preclude you from vaccination. So to all members of a Heart Foundation, please go for yours when offered.
Okay, yeah. That's all for our questions. Thank you for answering all the questions, Prof. Tan, and also for this very informative session. So once again, thank you everyone for tuning in. We hope the session has been, one last question. Do we have any priority channel to get the vaccination?
For elderly, I think if you're all 40 and above, you will be offered now. The only time where you can jump queue is you need to say that you need to go overseas or for study or something like that. But otherwise, we just wait for your turn. There's no urgency, but it's already being rolled out. 800,000 Singaporeans have already received this vaccination. That's only about 16% of our population. We still need to have more people to be vaccinated to make us a safe country here, at least 70 to 80% of people vaccinated. So no hurry. I think most of our members are middle age group and above. You should have your priority. In fact, you are the priority group that the government is targeting.
Okay, so thank you everyone for tuning in, and thank you Prof. Tan for this session. So with this, we would like to end the session. Yeah. Thank
Thank you, everybody.